Hi, I'm Bree Balchunas, and this is the Orlando Health News Review for October 28th. Our spiritual care teams throughout the organization encourage the growth and healing of mind, body, and spirit of our patients and our team members. When we think of healing, we think of our patients, but sometimes team members need to heal too. Take a look how team members at Dr. P. Phillips Hospital are receiving care after a stressful situation.
About 6 months ago, we started a program called Code Lavender here at Dr. Phillips Hospital. We wanted to stress that was for a team member in acute distress.
We have the little Code Lavender bags that are the care for the caregiver, and there's a number of items that are in here that kind of help them through.
Some of the situations that call for Code Lavender would be first-time patient death, a traumatic experience with a patient, or a favorite patient going into hospice. One incident which involved Code Lavender, the staff members that were involved were significantly impacted, and it allowed them to have an open and safe environment to discuss their thoughts and feedback, and then be able to take those back to their manager so that the issue could further be resolved.
You want everything to run smoothly as a nurse, and after this incident that had happened, it made me less confident in facing this kind of psychological aspect of taking care of the patient. After Code Lavender, it made me confident as a nurse in taking care of the patient. It made me aware that our managers are there to help us emotionally, to give us moral support.
And we feel this is just one way that we can let the team members know that they're cared for, because we want team members to know that being vulnerable is going to make them a better caregiver.
Code Lavender is just one of many services provided by the Orlando Health Spiritual Care Team. If you would like to contact the spiritual care team at your site, dial the operator and ask to speak to the spiritual care office. At the start of this month, Orlando Health, along with the rest of the nation, transitioned to ICD10. Thanks to a lot of preparation over the last several years and hard work of so many team members, this transition went more smoothly than could have been anticipated.
Just about everyone in this organization has been affected by ICD-10. The planning was tremendous. So I am very optimistic, cautiously, that we've got a couple more weeks to actually see the cash come in. Then we've got about 2 or 3 months before we'll really understand and appreciate the impact it's having to the organization from a revenue perspective. My thanks to everyone for the great job they've done. And now what we're waiting on is some final results in the next month or so. And then we're wondering when CMS will tell us that it's time to adopt ICD-11.
Visit the ICD-10's SharePoint page on Swift for more information. Finally, after delivering more than 10,000 Orlando City soccer jerseys, there are about 1,800 remaining. Team members who have not received a jersey, including anyone hired after February of 2015, will be able to order a jersey on Swift. Sizes are limited and there will be no exchanges. This is the last opportunity to order a jersey if you have not already done so. Visit Swift for all the details on how to order and when. That's it for today's edition. For the Orlando Health News Review, I'm Bree Balchunas.